title of my talk is Nasty or Nice, How Your Relationships Influence Your Health. In 1988, House, Landis, and Umbersam, House no relation to the doctor on TV, published a summary of recent research supporting a causal link between our social relationships and our health. They published this study in Science, one of the very prestigious journals, and the article was a wee bit controversial. Some would say still is. In the past 30 years, that article has been cited in more than 4,000 other journal articles, which is quite a contribution, and it's provided the foundation for the work in the influence of our personal relationships on our health. Basically, if your family and friends are nasty, your immune system pays a price and you're more likely to be ill. If they're nice, you're healthy. Of course, it's much more complicated than that, and good thing, because I have another 9.5 minutes up here. It shouldn't be surprising that health researchers are examining the association between relationships and health. Tonight, I'll only give you a very brief summary of the research in the area, and I'm going to focus mostly on psychological research, but there's research in many different disciplines. Psychologists have spent considerable research time and energy studying the importance of parent-child relationships, and in the last decade, the importance of adult personal relationships on health. Over the past 10 to 15 years, researchers have demonstrated that insecure children have elevated levels of hormones, such as cortisol, that are known to influence our immune system functioning. And more recently, insecure adult relationships have been shown to be associated with several serious and often life-threatening diseases. Attachment researchers have demonstrated that individuals who experience sensitive, responsive care from their parents tend to develop positive views of themselves and others, and these individuals are said to have secure attachment relationships. Basically, they're secure in the knowledge that other people will be supportive of them, and they believe that they are worthy of this love and support. And they looked for this from their parents, from their grandparents, from siblings, friends, romantic partners, and they just trust that other people will support them. In a 2001 paper with Deb Eldridge, I outlined the reasons why our early parental neglect may influence later health behaviors. First, we know that individuals with secure representations of the world, those who have a positive view of themselves and a positive view of others, are more likely to have effective coping skills, more likely to have supportive interpersonal relationships, and more likely to have constructive problem-solving skills. The research has also demonstrated that they're more willing to take care of themselves, and they expect and accept care from others. As you will see, they're also healthier and they make better lifestyle choices. In the first line of Anna Karenina, Tolstoy said that happy families are all alike. Every unhappy family is unhappy in its own way. With respect to attachment research, Mary Main, an attachment researcher, was one of the first to propose that in fact Tolstoy was correct, probably just a closet attachment researcher. Research has consistently found that there's one result from growing up in a happy family. As I just described to you, individuals who grow up in happy families tend to be secure. There are, unfortunately, many ways for families to be unhappy, or as psychologists like to say, dysfunctional. Parents can be inconsistent, they can be rejecting, they can be insensitive, they can be abusive, they can be unresponsive, they can be controlling. I think you get the picture. Each of these dysfunctional family dynamics results in different adult behaviors that all fit under one umbrella of insecure attachment. Insecurely attached individuals may avoid intimacy, they may crave intimacy, or they may fear intimacy. But the effect on their health is more or less the same. Lack of sensitive, responsive, consistent care during infancy puts one at risk for health difficulties later in life. So in the domain of physical health, attachment security has been found to be associated with behaviors that lead to a healthy lifestyle. So secure individuals are more likely to report engaging in health-promoting activities such as regular medical checkups, eating a variety of fruits and vegetables every day, yes, every day, getting regular exercise, and are less likely to report health risk behaviors. Conversely, insecure individuals tend to make particularly unhealthy lifestyle choices. So, for example, they are more likely to say that they smoke. They're more likely to abuse drugs and alcohol. They're more likely to have poor eating habits. They're less likely to exercise. They have poor sleep habits. They have a higher number of casual sexual partners. They engage in sexual risky behaviors such as unprotected sex or not knowing their partner's sexual history. They have multiple sexual partners. They correspondingly have a high rate of occurrence of STIs. They're also less likely to engage in behaviors that are mandated by the law, such as wearing a seatbelt. Insecure avoidant adults are not likely to seek medical attention for troubling symptoms such as chest pain. And conversely, insecure anxious adults are likely to seek medical attention for every ache and pain and have a high number of visits to healthcare practitioners. So once you get to the doctor, there's a couple of studies that have looked at treatment effectiveness, and I want to talk about one of my favorites. In 2005, a group of researchers led by Pressman reported that current adult relationships characterized by high loneliness and high social isolation, both which are typical of insecure attachment, were associated with poor immune response to influenza vaccines. So they got the vaccine, and the response was it didn't really work and didn't help to build up immune to that influenza. Now, this is only one study, and as far as I know, it is yet to be replicated, but these findings are consistent with what we would find, or what we would expect, given the results that I previously talked about, the earlier studies. So researchers have also found that adult attachment in particular is related to several chronic diseases such as diabetes and cancer. Now, with respect to cancer, we know that there are both environmental and genetic risks to developing cancer. So typically when we think of environmental risks, we think of things like exposure to toxins, exposure to radiation, as well as lifestyle factors such as diet or exercise. However, there is some evidence that your relationship environment, in particular your attachment to others, may also increase your risk of developing cancer. So for example, in the past decade, there have been several researchers such as Anna Tukan who've demonstrated that breast cancer patients reported significantly higher avoidant attachment and lower closeness to their parents than when they compared women who didn't have a history of breast cancer. However, to date, no published work has explored this complex relationship in humans beyond these simple correlational studies. Specifically, research has yet to determine whether avoidant attachment increases your risk of developing breast cancer, or whether the experience of breast cancer increases your risk of being avoidantly attached. There is, however, considerable research replicating these findings that parental neglect puts one at risk for breast cancer in other non-human mammals. And some of this research is done at Trent by our own Dr. Leslie Kerr, who is a faculty member in the Department of Biology. With respect to diabetes, Paul Chickanowski has published a number of studies exploring the association between adult attachment and diabetes. His research has found that although individuals who are secure and insecure tend to be diagnosed with diabetes, the disease progression and treatment outcomes are quite different depending on attachment style. Basically, secure people do better when they have a diagnosis of diabetes. Consistently, he finds that avoidant attachment, in particular individuals who will dismiss their attachment needs, have poor communication with their physician and poor adherence to their treatment goals. In particular, they're less likely to exercise, less likely to follow dietary restrictions, and more likely to smoke. Others have replicated these findings, and Chickanowski and others have proposed that physicians may find it helpful to assess attachment and use this information to develop supports. For example, since avoidant individuals find it very difficult to ask for help, it may be helpful to have more frequent check-ins, either by phone or by email, to remind them of their treatment goals, remind them that they should be exercising, remind them that they should be eating well, and to remind them about upcoming appointments so that they do come to those appointments. Inspired by these interesting findings from these early studies, researchers have started to explore the effect of attachment on a wider range of diseases. And in 2010, McWilliams and Bailey from Acadia examined the association between adult self-reports of attachment and lifetime experience of chronic illness. And the findings supported the hypothesis that insecure attachment was a risk factor for developing serious illness. In 2012, a group of researchers led by Jennifer Pugh explored this association in a longitudinal study looking at data from children who were 18 months old all the way up to 32 years. And what they found was that there was an association between secure attachment at 18 months and reports of no physical illness at 32 years. Conversely, individuals who were found to have an insecure, anxious attachment at 18 months were much more likely to report physical illness at 32 years. And in particular, they were more likely to report diseases such as coronary heart disease, asthma, bronchitis, emphysema, diabetes, and hypertension. And this is only kind of one. As far as I know, it's the first study to look at this over time. But given the strength of the findings, I suspect it will be replicated in the very near future. So I want to end today with another quote, and this one from Mother Teresa. She's reported to have said, "The biggest disease today is not leprosy or tuberculosis, but rather the feeling of being unwanted." And I agree with her. But there's much more research to be done, and I don't even think even Mother Teresa was aware of how the feeling of being unwanted could so profoundly affect our physical health. Thanks.